My name is Kara Alderson. I am in Nursing 5120, Section 439 with Mier. Here is my student ID, you can see. So today I'm going to be doing my problem-focused assessment. With me is CA. Before we get started, CA, do I have consent to interview you, assess you, and record this?
Yes, ma'am.
All right. So as you see, I have CA a list of his medications for memory, but this will just be with him. There is no non-medication information on it, and it's blank on the other side. That is going to him. I then have a blank piece of paper for me. As you can see, two-sided, it's blank, nothing on my clipboard. So we'll start with my scan of the room. We're doing this in my RV because it's the easiest to be clean. We have an empty seating area over here where we will do the assessment. Another empty seating area. We have the kitchen area. There's some stuff on the bar, but you can see it's nothing that would help me with this assignment. Before we get started, I am going to do a short memory dump. And get this back where I need it. And down just a hair. Alright, so I've completed my memory dump. As you can see, just a little writing on this piece of paper. And I'm going to step out. When I come back in, we'll get started.
Come in.
Hello, my name is Kara. I'm going to be interviewing you and assessing you today. Before we get started, can you please tell me your name?
CA,
Your date of birth?
July 20, 1946.
What is your gender?
Male,
And what is your ethnicity?
white.
Alright, so what brings you in today?
I've had a sore throat and fever
Okay, when did this sore throat start?
a couple of days ago.
Alright, and were you feeling normal the day before?
Yes.
Was it a sudden onset or was it gradual?
Oh, it was a sudden, overnight.
Okay, and did you wake up with the pain?
Yes.
How would you describe the pain? Is it sore? Is it sharp? Is it achy?
Just kind of sore.
Okay, and is it sore on both sides?
Yes.
Where exactly do you feel in your throat it's sore?
In the tonsil area in the back of the mouth.
Okay, and you said it's been 2 days?
Yes.
Does anything make it better?
I can drink. It's like a warm broth will help.
Okay, and does anything make it worse?
Not really, no.
All right, and severity, 0 being no pain and 10 being worst pain possible. What's your pain?
About a 5.
Okay, and you said you had a fever?
I've had a fever, but I was able to take 2 Tylenol and it relieved the fever.
Okay, do you know how much how many milligrams of Tylenol that was?
No.
Okay. Do you know if it was the regular strength or the extra strength?
It was a regular strength.
All right, and how often have you been taking that?
Just as I feel feverish, and it was running about 101.
Okay. Did the Tylenol fix that fever?
Yes.
Did you retake it afterwards?
No.
Okay. And when was this fever?
When was it?
Yes,
oh,
sir.
It was in the morning when I woke up.
The 2 days ago?
Yes.
Okay, and any chills with the fever?
No.
All right, anything else I need to know before we move on?
Not that I'm aware of.
All right, so I'm going to go ahead and learn more about your past medical history so I know you a little bit better. Have you ever had any surgeries?
Yes.
What did you have done?
I had a bleeding ulcer, and they did a tube down my throat and found 2 bleeding ulcers at the entrance to my stomach. And they started me on medication, which has controlled it very well ever since.
Okay, good. Do you know what that medication is?
Yeah, omeprazole.
Okay, and how often do you take it?
Once a morning.
All right. Do you know how many milligrams?
Yes, I do. It is 20.
Okay. And did you have to have any blood products for this?
Yes.
Any reaction to the blood?
No.
All right. Any other surgeries?
I've had some skin cancer, carcinomas,
Okay.
and I've had about 3 of those where they've been removed surgically.
Okay, you said 3 carcinomas?
I believe so, yes, ma'am.
And do you know when the last time that was removed?
It's been probably, I'd say 5 years ago,
Okay.
so about 20 to 15.
Okay. And have you ever had any melanomas?
I've had a melanoma. That was a surgery too. It was on my top of my ear on the left side.
Okay. Did that require any chemo or radiation?
No.
Are you going to a dermatologist to get your skin checked?
I have a checkup every 6 months.
Okay, good. And have you ever been hospitalized besides with that bleeding ulcer?
No.
Okay. Have you, are you up to date on your immunizations?
Yes.
Have you had a flu shot this year?
Yes.
Have you ever had the pneumonia vaccine?
Yes.
Have you had a tetanus shot in the last 10 years?
Yes.
And have you had any COVID vaccines?
I've had a regular shot and 1 booster.
Okay. And do you know what manufacturer that was?
It was Pfizer.
All right. And have you ever had any traumas? Car injuries, concussions, anything like that?
Well, when I was real small, I was climbing over the seat in an old Plymouth that had suicide doors. And anyway, I hit the latch and it threw me out of the car when I was less than 2 years old. Anyway, they didn't think I was going to live, but they sewed me up, and then they realized that I was going to be okay, and they sent me home.
Okay, good. Any residual deficits from that?
No.
Okay, good. What illnesses have you been diagnosed with, or conditions?
Basically, just my sugar diabetes.
Okay. And do you have a list of your medications with you?
Yes.
All right, what are you taking?
Metformin, 2 pills in the morning and 2 at night, 500 milligram.
Okay.
I have a glypiride, 2 milligrams. I take 1 pill nightly for my diabetes.
Okay.
Omeprazole, 20 milligrams, 1 pill in the mornings for my acid reflux. Simvastatin, 20 milligrams, 1 pill nightly for high cholesterol. 20 grams of lisinopril, 1 pill daily for high blood pressure. And I've been taking a pill of about 350 milligrams of magnesium in the morning, and at night my magnesium levels have been low with my blood work on my physical checkups.
All right. When was your last physical exam?
About a month ago.
Was your magnesium normal on that at the time? Good.
Yes.
And then I saw you're on some medications for your diabetes. Do you know if your A1C was checked on your last exam?
Yes, it was.
Do you know what it was?
It was 7.7, down from a 9.3.
Okay, good. Just continue diet and exercise is what you're doing?
Yes.
Okay, good. And then you said you're on simvastatin. Is that for high cholesterol?
Yes.
Okay, and then lisinopril for high blood pressure?
Yes.
Have those been pretty controlled with your medication?
Yes, they're very well controlled.
Okay, good. Are you allergic to any medications?
Not that I'm aware of.
Okay. Allergic to latex?
No.
Any environmental or food allergies?
No.
And then you said you had your exam. When was that last one?
About a month ago.
Okay, so February 2020?
That'd be pretty close.
Okay.
Except it'd be 2022.
2022, yes, that's what I meant to say. Thank you. So now I'm going to go ahead and take some social history. Do you use any tobacco, alcohol, or drugs?
No.
What's your current living arrangement?
I live in a house with my wife and daughter.
Okay, do you have everything you need there? Food, water, electricity?
I do.
Do you feel safe at home?
Yes.
And what's your occupation?
I'm a retired school teacher, public school. Been in public school for 53 years, but I am currently farming and ranching, raising goats and baling hay.
It sounds like hard work.
It keeps me busy.
Yes, it's good to stay active.
Yes.
Do you use any pesticides with your farming?
No.
Okay. Any other toxins that you
No.
might encounter?
No.
Okay. Are you sexually active?
Yes.
And any history of STIs?
No.
And do you have any religious beliefs that would affect your care?
No.
And do you have any pets?
I have 2 bird dogs. I like to go quail hunting.
Okay. Any allergies to the dogs that you know of?
No.
Okay, good. Now I'm going to take some family history to know what to look out for. Are your parents living?
No.
I'm sorry to hear that. Do you know if your mother had any medical conditions?
She had a stroke, and then later, which caused her passing, they found bone cancer.
Okay. How old was she when this happened?
69,
And what year was that?
1990.
Okay. Did your father have any medical conditions?
He had diabetes, and he had a heart attack, which caused his death also in 1990.
And how old was he?
He was 69.
As far as you know, did your mother's mother have any medical conditions?
She had a stroke and later passed from the stroke.
Okay. Do you know if your maternal grandfather had anything?
He had asthma and also emphysema with the asthma.
And what about your paternal grandmother?
She was very healthy. She lived to be in her mid-90s and died of a heart attack.
Okay. And then your paternal grandfather, do you know if he had anything?
He had a heart attack and, well, he had a stroke first and then later a heart attack.
Okay.
And he was 84 years old.
Okay. All right, so now I'm just going to go over review of systems, make sure I haven't forgot anything before I assess you. So you said generally you had a fever, but no chills. Is that correct?
That's correct.
Any decreased appetite?
No.
All right. Any problems eating or chewing or swallowing with your sore throat?
No.
Have you noticed any rashes or changes to your skin since this
No.
started? Have you had a headache?
Slight, but the Tylenol was able to relieve it.
Okay. Any pain in your eyes?
No.
Any redness or discharge?
No.
Any changes in hearing or ear pain?
No.
Any discharge from your ears?
No.
Have you had a runny or stuffy nose?
No.
And then you said your throat, obviously it's sore. Have you noticed any swollen tonsils?
No.
All right, and have you noticed any discharge from your tonsils?
No.
Okay. Any problems breathing, any shortness of breath?
No.
Any cough?
No.
And have you had any racing heart rate or palpitations?
No.
Okay, any swelling in your hands or feet?
No.
Any stomach pain?
No.
Any nausea, vomiting, or diarrhea?
No.
Have you had any pain when urinating?
No.
Any changes in the amount or frequency you're urinating?
No.
Any change in color or odor?
No.
Have you noticed any swollen lymph nodes along your neck?
No.
Any increased bruising or bleeding?
No.
All right. Any change in mood since this started?
No.
And what about any dizziness or confusion?
No.
Okay. So that concludes our review of systems. I'm going to go ahead and start assessing you now. Alright, I'm going to start with your eyes. We see the sclera is white bilaterally. Conjunctiva is pink and moist. There is no discharge and the lens is clear. Any pain on your frontal sinus here?
No.
Or your maxillary here?
No.
Okay. Now I'm going to look at your mouth if you'll open wide. The mucosa is pink and moist. Smile for me. Teeth are intact. There are some dental crowns present. He does have some enlarged and red tonsils. There is no exudate noticed on the tonsils. There is some edema and erythema to the tonsils, and there is no signs of post-nasal drip such as cobblestoning. I am now going to look in your nose. On the right nair, the mucosa is pink and moist. There is no nasal discharge. The turbinate is intact. There is no obstruction or structural issues. Sorry, sir. I'm going to go to the left nostril over here. Again, mucosa is pink and moist. There is no discharge. The turbinate is intact. There is no drainage noted and no structural abnormalities. I'm now going to look in your ear. All right, so his tympanic membrane is pearly gray. It is intact. There is no perforation. There is no exudate or cerumen noted. There is some ear hair, and his skin is pink and intact. Now going to go over to the right ear. Once again, we have a pearly gray tympanic membrane. The skin is pink and intact. There is no exudate or ruptured tympanic membrane, and there is no obstruction or cerumen noted. There is some nasal hair, or ear hair as well. All right, I'm now going to look at your neck. I'm going to palpate your thyroid. Thyroid appears normal. There is no thrill noted. And can you swallow? Thyroid cartilage moves when swallowing. I am now going to palpate your lymph nodes. I'm going to start at the occipital. Going to move over to the postauricular, preauricular, tonsillar, submandibular, submental. All right, if you can unbutton your shirt for me, sir. All right. Then we're going to go on and move. You can just lay it on that chair. Yep, right there. Thank you, sir. We're going to do the posterior cervical, anterior cervical, and the supraclavicular. No lymph nodes are palpable. Did you have any pain with that, sir?
No.
No tenderness, no swelling is noted on either side, and there is no redness or change in color noted. I'm now going to move and listen to your lungs. I'm going to use the diaphragm of my stethoscope. If you'll just take a deep breath every time I place this down. All right, breath sounds were noted in all areas. There were no adventitious breath sounds such as crackles or wheezing. Breath sounds were clear and equal bilaterally with no diminished breath sounds. And if you'll turn and put your back to the camera, please. Going to once again listen to breath sounds on his back. If you'll just take a deep breath every time I place the diaphragm of my stethoscope down. Once again, breath sounds were noted to be clear in all fields. They were equal bilaterally and non-diminished. There were no adventitious breath sounds such as wheezes or crackles. I'm now going to have you take a deep breath. Chest expansion is noted to be symmetrical with inhalation. All right, and you can turn around for me. I'm now going to listen to your heart really quick using the bell of my stethoscope. Going to go to the second intercostal space on the right sternal border. S1 and S2 heart sounds are noted. There are no extra heart sounds and no clicks or murmurs. And that was listening to the aortic valve. I'm now going to go to the second intercostal space on the left sternal border and listen to the pulmonic valve. S1, S2 heart sounds were noted. There were no extra heart sounds, clicks, or murmurs. Going to move down to the third intercostal space on the left sternal border and listen to the Erb's point. Again, S1, S2 heart sounds are noted. No extra heart sounds, clicks, or murmurs. Move on to intercostal space 4, left sternal border, listening to the tricuspid valve. Again, S1, S2 heart sounds were noted. No extra heart sounds, clicks, or murmurs. Go down to the 5th intercostal space, mid-clavicular line, listening to the bicuspid valve. S1, S2 heart sounds are noted. No extra clicks, murmurs, or other heart sounds. Going to go back to the 5th intercostal space mid-clavicular line with the diaphragm of my stethoscope and listen to his apical pulse. Apical pulse is regular. There were no irregular rhythms noted. No extra heart sounds. S1, S2 heart sounds were noted. Also, I saw the vitals for this patient were taken before he came in. His oxygen saturation was 97%. His pulse was 97. His temperature was 97.7 degrees Fahrenheit. His blood pressure was 126/78. And his respiration rate was 16. All right, so I have finished listening to you. My thought is that you probably have acute tonsillitis. At this moment, we're unsure if it's bacterial or viral. What we'll do is we'll have a nurse come in. We're going to get a rapid streptococcal antigen test to see if it is strep throat. If it is, I will give you some antibiotics. Are you allergic to penicillin?
No.
So amoxicillin would be the medication I would give for that. If it is viral and the strep test is negative, you're just going to continue to hydrate, drink plenty of fluid slowly throughout the day. If you feel like you start swallowing less because your throat hurts, you don't want to eat or drink, you can drink some Pedialyte or some Gatorade to help keep you hydrated. On top of that, you can continue to take Tylenol for pain and fever like you were. You can take 650 milligrams or 1,000 milligrams. Just make sure you do not exceed the daily recommended amount of 4,000 milligrams per day. You can use a cough drop for your sore throat if you want to. Besides that, get some rest. There's no reason to get any blood work done at this time. No reason to follow up as long as your sore throat and fever get better in the next few days. If they get worse or do not resolve, you would want to come back in. Do you have any questions for me?
No, ma'am.
All right. Well, I hope you feel better.
Well, I appreciate it. Thank you very much.
Thank you.